Let's talk about what's been happening in WA in particular. We've got one man who's died in emergency at a hospital in WA, the first Australian to die from the coronavirus after contracting the disease aboard that ill-fated Diamond Princess cruise ship. I just want to go to you, Caroline, first, if I may, because it has occurred where you are in Perth today. What is the mood like, do you think, out there, given the fact that we were talking about the R word yesterday, and then today we've recorded our first death? What's the mood like out in the public? Are they fearful? Are they protective? Are they stockpiling? What do you think?
Look, to be honest, I went to the shop this morning and it's pretty business as usual in Perth. I suppose the two cases that we have in WA at the moment, like you said, they're a husband and wife who came off the cruise ship. They came via quarantine in Darwin to WA. So we know exactly what their movements have been, and we know exactly how they contracted the virus. So I think you might start to see a little bit of angst in WA when we get our first case where we're not quite sure where it came from and we haven't been able to contain it in the same way. So everything's fine at the moment, but it is very tightly held. So
yeah.
We'll have to wait and see, I think, Chris.
I think Caroline is right in terms of that death. It's sad that it's occurred, of course, and even sadder that the wife is now in hospital suffering the same thing and having to deal with the loss of her husband. Just awful. Are we overreacting a little bit? Because although we've got, as I said to Tim Harcourt at the beginning of the program, 25 with coronavirus, we don't have 25. There have been 25 cases, but we now have about 4 or 5 cases. Yeah, look,
the problem is we don't understand it. And in fact, I suspect the medical profession doesn't properly understand it. They're still learning things about it. So this COVID-19, which stands for coronavirus disease strain 19, they're still working out how it works. We don't know its infection rate and don't know its death rate. It appears to be the case that you can be very easily infected. It looks as though it's much easier to catch than, say, SARS was, which was also a type of coronavirus. It was an earlier strain. So the infection rate seems to be high, and the Diamond Princess seems to prove that. Very high infection rate, very easily transmitted. The death rate, no one knows yet. With influenza, the death rate is something like 0.13%. Now, I've heard one expert, the experts can't agree. No. I've heard one expert say the death rate for coronavirus is going to be something like 0.2%. But another one said, oh, it might be anything 2 to 2.5%. The problem is when there's that level of uncertainty amongst the experts, that makes us nervous.
Well, should we shut the gate to, for instance, trips from Italy into Australia? Should we shut the gate to trips from Seoul, from South Korea?
No, and I'll tell you why. Because they are fairly modern, well-established countries. They're transparent, they're open, they tell us the truth, and they've got good health systems. The problem with both China and Iran is they're highly secretive, authoritarian states. They don't tell us what's really going on, and I don't think we've got confidence in their health systems. So there are reasons for saying no to China and Iran and not other countries.
Yeah, you make a very good point. Now, the United States has joined Australia in banning travel to from Iran to the US as they respond to the widespread outbreak of the virus. They're now considering closing the border to Mexico, Caroline. When you've got, hundreds of millions of people in a country and you've only got a dozen or so cases of coronavirus, they don't have it too tough at the moment.
No, they've actually done pretty well. I'm a little bit surprised, and I suppose compare that to Australia, and I guess this is the blessing we have in having no land borders. It makes it much easier to control people coming in and out of Australia. The problem with the Mexico border is the amount of traffic that goes both ways across it on a daily basis. So it's not like Australia here where we know how many flights go in and out each day. We can monitor that very, very closely. This land border has a lot of traffic, and the other issue is, similar to what Kel had to say, but perhaps slightly different in a sense, is that while Mexico is probably going to be cooperative in assisting, they don't have the same level, let's say, of healthcare as, say, somewhere like Italy or South Korea does. So I can understand why there's a bit of angst in the US. It's a big call to make. It's a very big call.
It is a big call, and I wouldn't want to be the Prime Minister having to make these calls, or the President in the case of what we discussed then.